Let's talk about the nasogastric tube.
What? What is the nasogastric tube?
Nasogastric intubation is a medical process involving the insertion of a plastic tube through the nose, past the throat, and down into the stomach.
And what is the purposes to use it?
A nasogastric tube is used for feeding and administering drugs and other oral agents.
Okay. So how we done that procedure?
First of all, and of course before any procedure, we must assess the client. We must assess the history of nostril surgery or deviated septum. And you must assess the presence of gag reflex.
After that, what we must do?
We must determine the size of tube to be inserted. And determine whether the tube is to be attached to suction.
What is the equipment that we need to this procedure?
Nasogastric tube. Jelly or any lubricant substance. 60 milliliter syringe or Salem syringe. Glass of water. Light. Towel. Stethoscope. Clamp or plug. Disposable gloves. Adhesive tape. And safety pin.
After preparation the equipment, what we must do?
Introduce yourself and verify the client's identity. Explain to the client what you are going to do. Wash your hand. Provide for client privacy. Assist the client to a high Fowler's position, if health condition permits. And support head on a pillow. Place a towel or disposable pad across client's chest. Ask the client to hyperextend his head, and using a flashlight, observe the intactness of the tissues of the nostrils, including any irritations or abrasions. Examine the nares for any obstructions or deformities, by asking the client to breathe through one nostril, while occluding the other. Select the nostril that has the greater airflow. Determine how far to insert the tube, by use the tube to mark off the distance from the tip of the client's nose, to the tip of earlobe, and then from the tip of the earlobe to the tip of the xiphoid, and then mark this length with adhesive tape. Then put on gloves.
Then what we do?
Lubricate the tip of the tube well with water-soluble lubricant or water, to ease insertion. Insert the tube, with its natural curve toward the client, into the selected nostril. Ask the client to hyperextend the neck, and gently advance the tube toward the nasopharynx. Direct the tube along the floor of the nostril and toward the ear on that side. If the tube meet resistance, withdraw it, relubricate it, and insert it in the other nostril. Once the tube reaches the oropharynx, throat. Ask the client to tilt head forward, and encourage the client to drink and swallow. Pass the tube 5 to 10 centimeters with each swallow, until the indicated length is inserted. If the client continues to gag, and the tube does not advance with each swallow, withdraw it slightly, and inspect the throat by looking through the mouth.
Okay. And how to know if the tube is in stomach or not?
Aspirate stomach contents, and check the pH. X-ray as per agency police. If a small bore tube is used, leave the stylus or guide wire in place until the correct position is verified by X-ray. Or place a stethoscope over the client's epigastrium and inject 10-30 milliliters of air into the tube while listening for a whooshing sound.
Wow. What after that?
Secure the tube by taping it to the bridge of the client's nose. Attach the tube to a suction source or feeding apparatus, as ordered, or clamp the end of the tubing. Secure the tube to the client's gown.
Thoughts everything?
And of course documents relevant information.